everybody. We're back with another week of quarantine self care. This week, we're going to continue on with the stretching series that I started last week. And this week, we are going to focus on the hips. So, last weekend was really nice. This weekend is Memorial Day weekend, as well as my birthday. So, let's get those hips up and stretched out. You know, a lot of people have been sitting either working or binging, binge watching, I should say, maybe binge eating, who knows. So, you know, let's just kind of get those hips moving. So if this weekend is really nice, as long as I hope you are safe in whatever you decide to do, yeah, just want to make yourself good to go. Get those muscles all warmed up. All right, so to start off, what I'm actually going to do is it's called a hamstring elevation, but it's just a really good way to start off the stretching protocol. It's just a way to calm down the nervous system, promote mindfulness, get yourself centered. You know, it also helps the blood flow in different directions. So, yeah, it's really simple. What you're going to want to do is get up against the wall. So, I'm actually going to turn around to show you and do it up against my handy dandy massage table. All right, so just leaning up all again, right against the wall or whatever your flat vertical surface is. Just kind of hang out for a minute. Take a couple deep breaths. And just kind of, if you're doing these stretches at the beginning of the day, set your intentions for the day. If you want to save this for like the end of your stretching routine as well, or if you want to do it both at the beginning or the end, you can kind of meditate after you stretch and set your intentions for the day, or just whatever your goals are, or your general mindset. If you're doing it at the evening, in the evening, you can kind of reflect on your day, pros, cons, you know, anything important. If you want to reflect on the COVID situation, you know, but yeah, it's just a really good mindful technique that helps to relax and get the blood flow going. From there, you're going to want to go into internal rotation of the hip. So whatever hip you're going to stretch, you're going to bend first. And I'm going to slide it. You don't want to be as close as you were for the hamstring elevation for this. So back up a little bit. And then, so you're going to stretch, this is my left. So you're going to cross your right over your left. And you want to be like right above the knee in this nodule, like that indentation almost, and put your heels there. But don't dig in too tight, because your knee is obviously a very delicate bone, and there's a lot of nerves and endanger sites close there. So gently place it in that sweet spot and stretch over to the other side. Now, this isn't the same as when you are doing the glute stretch. and you're bringing it all the way over, like you will get that a little bit, but this is more targeting the internal hip rotators, and you should feel it like right up in the hip bone. If you can see where I'm pointing. If not, you can sit up anyway after that's done, right here. Okay, so along with that, we are going to then get right into the TFL stretch. The TFL is the tensor fascia lata. It kind of sits right up here. It's a hip abductor, meaning it medially rotates your hip. It medially rotates the femur. So yeah, it's a small muscle, but it's a pretty important muscle, and it works along with the glutes in, you know, kind of performing its actions. A lot of people will feel pain there. It can be a really tender spot when it's massaged, so chances are you'll feel a pretty good stretch. Okay, so we're going to show two variations of the TFL stretch. They're both pretty similar. One just has your opposite knee bent, and the other one has it straight. So you're going to want to take your rope, and for the first one, you're going to wrap it around the foot that of the hip and leg that you're going to stretch, and then you're going to lay down. So then taking the opposite leg, you're gonna put it over kind of the same way of doing a glute stretch, which we'll show later. And then you are going to want to loop right so that it's through the leg, so that it's easier to pull to the opposite side when we're doing the stretch. Okay, so in there, if you have a towel, same deal. Obviously you might want to get a larger towel, or if you can find any sort of rope, or you know, something with a little bit more length and thickness to it to hold your foot. Okay, so the leg that you're stretching is straight out and neutral. Then from there, you're going to turn your foot outward, just your foot. So you're laterally rotating it, or turning it towards away from your body. So then you're going to take your hand and stabilize your hip, because if you're doing this stretch and your hip's coming up off the ground, we're not targeting the correct muscles. So leg straight, foot turned outward, hand right on the hip to stabilize. Take a deep breath. On the exhale, using your rope, stretch, and still keeping your toes laterally rotated. Stretch across your body. It might be difficult to get the hand of at first, right? Because you're doing all these things at the same time. But once you get it, we get a really good stretch right in here. Okay, so the other variation is both legs are straight up, flat on the ground, no knees bent. You're going to lift the leg that you are stretching. Again, every step from here on is the same. Laterally rotate your foot out, hand on the hip to stabilize it. And you may not feel like you're doing much with this stabilizing, but even that little bit of resistance helps to kind of keep it where it's supposed to be and targeted on that muscle, right? So then again, exhale, exhale, and then drag across your body, hold for 2 seconds, come back across, relax, another deep breath. All right, so that is your TFL muscle, your tensor fasciae lata. Next, we're going to move on to the lateral hip rotators. So this one is sort of assisted as well. So with the lateral hip rotators, what you're going to do is sit with both legs straight. Put your hands on above the knee of the leg that you're stretching, and then you're going to medially rotate your thigh and your leg. See how it's moving in towards the other leg. So that's part of it, right? That's the first part. Then, because your hands are resting right above your knee, when you internally rotate, you're going to assist for 2 seconds, right? So you're kind of twisting it additionally. And that helps to really get into the hip rotator. Right? Some of these muscles, they're just so hard to stretch because of where they're located, or there's just so many layers on top of it, and there's just going in so many different directions. So you want to really make sure to target your medial rotators of your hip by assisting with your hands. So you will then hold for 2 seconds, right? Just like every other stretch. Exhale as you're going into the stretch. And then repeat 2 to 3 times. All right, so if you want to take that to another level, you can do what's known as PNF, or proprioceptive neuromuscular facilitation. Yes, it's a big word, or a couple of big words. So what that is more resistive stretching, or resistance stretching, I should say. And it just helps to target certain groups a little bit better, and it even can strengthen those muscle groups a little bit. Traditional stretching does increase your range of motion, but this can help even more so, and it can also help to break up a little bit of fascial restrictions that are in the fascia. So what you're going to do for your lateral rotators for that is kind of the same deal. So you're going to put your hands right above the knee. Now, instead of turning the foot in and immediately rotating right away, you're going to laterally rotate while putting pressure against this hand, right? So you're laterally rotating while resisting against the movement of the leg with your hand. So you'll do that for 10 seconds. Laterally rotate 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Inhale. On the exhale, you're going to then internally or medially rotate and then assist with the stretch. Right, so you're doing two opposite muscles. You are activating the antagonist muscle, the opposite muscle from the group that you are trying to stretch, therefore kind of confusing the muscle a little bit and allowing it to stretch a little bit farther and break up any fascial adhesions that may be kind of right there on the surface. You know, it's not going to break up all the adhesions right on its own, especially not from doing this, you know, once, but keep at it and you'll find that you'll have more range of motion as time goes on. And yeah, so again, laterally rotate, resist with your hand for 10 seconds, pushing against, relax, inhale, medially rotate, and then assist with the stretch with your hands and relax. And then repeat that 2 to 3 times for each time that you do this. All right, so that is the lateral hip, and we did TFL. So let's go on to the medial rotators. Let me see 1 second. Yes, so I'm sorry. That was for the lateral hip rotators. That last one that we did, lateral hip rotators, not the medial ones like I think I may have mentioned. Next, we are going to do the medial rotators. So for this one, you're going to want to lay on your stomach. So if it's better not to do it on the ground, you can lay on your bed might be the best option. The couch might be a little too lumpy and uneven to do the stretch. Okay, so for the medial rotators of the hip, you're going to want to take your towel or your rope, and we're going to do a little bit more PNF for the medial rotators. So laying down, you're going to have the foot you're not stretching, this guy, straight, and then the one that you are stretching, this guy, bent with the rope wrapped around the ankle. So from there, you're going to just partially separate your legs, not even shoulder width apart, just a little bit. And then against resistance of the hands, and pulling at the rope, you're going to turn your foot outward for 10 seconds. Breathe in, foot out, right? Do you see how it's going out like that? So, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Take a deep breath in and stretch again, but now toward. And you'll feel it all right within here, but you can tell that it's more internal than kind of right on the surface. we'll get into the psoas, but of course, if you know anything about the psoas, you know that you have to work it through the stomach, which I have shown in another video. So again, you are resisting by laterally and pulling. So it's a counter lever, right? You're pulling on this side while your leg is pulling this way. Relax, and exhale. All right, so that are your medial rotators of the hip. Okay, so for the abductor stretch, you want to have your foot straight that you're stretching, and this might be a little excessive, but it was the best grip that I could get to give myself a good stretch. But you want to hold so that it's, around the heel. And then to stretch your abductors, you're kind of going to want to pull toward yourself, right? You get all in here, right up into the groin even. So it's just a nice pull to do it, to get that stretch even better. While you're pulling, you can try to turn your foot inward, right? So you're trying to turn your foot in toward your body. And that will get all the adductors. And those muscles add to your body, right? So they're coming to the middle of your body. Your abductors, your abductors are your muscles like tensor fasciae lata, piriformis, sartorius, superior gemellus, your glutes, and your TFL. Did I say that already? I don't know. So those are all your abductors, and they are responsible for pulling away from your body, right? So more like lateral rotation and medial rotation, if you will. Add is more medial, ab is more lateral, away. Okay, so with that little anatomy lesson, we're gonna go into the lovely, we'll save the psoas. So, I have another stretch for the lateral rotators. So, laying back, you'll bend the leg that you're going to stretch, and again, supporting to stabilize the hip, and then internally rotate or medially rotate. It's internal too, but yeah. And that is a good one, a good easy one. No strap needed. There's no PNF or resistance, just other than your hand. And you can get that stretch just as well. All right, that one's easy. So then we're going to move on to the hip flexors. This one you're going to want to lay on your side with one leg bent and the one that you are stretching out straight. Now again, this one might be better to do off the side of your bed, or if you have a massage table or a different surface you want to use. If not, you can just do it on the floor by simply keeping your leg straight and pulling it back. So that gets right into your hip flexors. Right, so one leg bent on your side, opposite leg, the leg that you're stretching out straight. And then if again you are on a surface that's higher than the floor, you're just going to want to drop it back, like either off of that surface or at least to where you're feeling a stretch. You don't want to push it too far, or B, if you're not sure and you don't feel a stretch yet and you keep going, I'd say at least to the lower part of your leg is off the side of the table. And that's your hip flexors. Now, you could use the stretch rope for that if you want to bring your stretch even farther. If you want to do that, so then if you're doing it with a strap, you just lay down, keeping this leg straight, and then, go back as far as you can, and then add a deeper stretch by making sure that your leg is still straight, but pulling up on the rope. And that's your hip flexors, both with and without assistance with a strap. Okay, so another really good hip stretch, which is probably one of the more popular hip stretches, is just the twists. So this is often found in yoga, but is found in traditional stretching as well. It's personally one of my favorite stretches to do. So laying on your back. So turn your hips to one side. And look to the opposite. And then switch to the other side. And again, looking opposite. And you can do that a couple of times. You can take the stretch even deeper by putting this leg over. Right? That was pretty much the first stretch that I did up against with that rotation. All right, then from here, we're going to go into the glute stretch, which is crossing the leg over, holding under the bottom leg, right under the knee, and bringing forward. All right, and get all those good glute muscles, mostly glute maximus. If you want to get piriformis, that is more, again, from that exercise, but bring it more across your body. So glutes is straight back, whereas piriformis is more across the body because it goes on an angle. All right, so we've pretty much gotten through all of the muscles of the hip. Now we're going to save the best for last and work on everybody's favorite muscle, the psoas. Okay, so the psoas muscle, if you're a client of mine, if you're a regular client of mine, if you've had hip issues of any kind, I'm sure you have experienced some psoas work from myself. This is not always the easiest muscle to work. This is not always the most comfortable muscle to work. So, without going into too much of an anatomy lesson, the big thing with the psoas is so it flexes the hip and it brings your upper leg, your thigh, towards your body, the rest of your body, right? So people who sit a lot, dancers, people who may like be in a hunched over position where this area, sorry, my knee's in the way, where this area is just like really constricted and tight, most likely have a tight psoas. Now, it can also contribute to or feel like sciatic pain a little bit because it can compress the sciatic nerve, can cause low back pain, it can constrict the organs and breathing. It is, I'm going to pull up a picture. Hopefully this will work through my phone, but it's the easiest way that I can do it since I don't have all the editing skills. All right, so this muscle is your psoas muscle. And I'm sorry I haven't done this with other muscles, but the reason why I wanted to show is because how it attaches to the lumbar spine, right? So your L1 through 5, and then it comes over the front of the hip, and then it crosses over another joint and comes like, it's not so much in the back of the leg, but more on the inside of the femur, right? So that's the outside of your thigh, and you probably can feel that bone depending on your body type, or at least obviously know that it's there. And then this piece where it attaches is on the inside of your leg. So basically it attaches on the back, it comes through the stomach, it crosses over the hip, and then attaches in here. So most muscles, they only cross like one joint, but this one crosses over two joints, right? So you've got the hip joint up here, and then you have your femur joint down there, which also connects into this fossa, which is where your leg bone connects into your hip, right? It's a fossa is what it's called. So it's just where that capsule fits in to the hip like a puzzle piece. All right, so that being said, the psoas muscle tends to get very tight and it's very restricted, and not a lot of people like to work the psoas, and not a lot of people like to have their psoas worked, especially if they've had a bad experience. That's why when I do it, I try to be as gentle and as slow and as communicative as I possibly can when working the psoas. And it's probably when I get cursed out the most. So, a really easy and the most common psoas stretch is a simple lunge. So, taking the ball, you're going to be stretching the psoas of the leg that is in the back. So, right now I'm stretching my left leg because that's in the back. And you want to get into a low lunge. And you're stretching that muscle. I'll show it on this side, even though the ball should be on that side, just for the purpose of showing what I'm doing. Right, deep lunge. We're stretching this psoas right in here. If you can't go that deep of a lunge, that's fine. If you have no balance like myself, practice more yoga. Yeah, so you can lunge straight. If you want to put your knee down more, you'll feel that as well. And so that is the most common and the easiest psoas stretch. Another one that you could do is even just resting with the lunge. You can, like, if you can't do a lunge where you're both in the air, or both your legs are in the air, then you can keep your knee bent and then just kind of roll forward. You can use, if you have one of these balls, to get more of a stretch, you can just like slowly roll on it. And then you could also use a chair, in which case it wouldn't be so easy to like gradually go into that stretch. But if you put it so where it's not like right in front of you, the chair, but out a little ways, then you can even support with your other hand on the floor and just kind of like skate, right? If you don't even want to use a chair, honestly, that works just as good. You're still getting that stretch in there. And if you don't want to hold your arm out either, just kind of like a runner, right? But getting more into that stretch. Right? Another way that you could do it even laying down. Put this knee up in front of you and then this leg straight. And then right? All those yogis know that one. Another one that you could do for your psoas. We did this one last week for the low back, but again, I did say that it would get the low back and that some of these stretches would be repeated. So do a simple bridge, glute bridge, right? And you'll feel that stretch a little bit, not so much as in the lunge, but you'll still get a little bit of a stretch. And at the very least, you're getting those muscle fibers that are like closest up into the lumbar spine. Another psoas stretch is a frog, or I think it's actually called a half frog. So laying on your stomach, this is sort of the move that I did prior, but instead of having your leg up in the middle and then down this way, and just switching for demonstration purposes, you're going to want to have that leg out and then this one out to your side, sort of in a figure four, just like this, and then rest. Again, all these stretches hold for 2 seconds. If you want to hold it till 5 seconds, it's not going to hurt you. Release, and then repeat a couple more times. Okay, so the last one that I'm going to show you real quick is called the hero pose. This one is really good for the psoas. It's also a great grounding ending tool or ending technique as well. So if you want to do this instead of the hamstring one that I showed at the beginning up against the wall, then go for it. All right, so you're going to take a block or a book and kind of line it up with your tailbone, and then, place it between your legs, and then with your knees as close as you can get them, and kind of like squeezing the block, if you will. You're just going to lean back and sit up straight. And you should feel that in your psoas. Now, if you don't feel that stretch or you want to take it a little bit deeper, just walk your hands back, keeping your body as straight as possible and remembering that you want to get a stretch in this area. Okay, after 2, walk yourself up. You can sit there and just meditate for a minute if you'd like after doing the stretch 2 or 3 times. Remembering that despite all the craziness that's going on, there is a lot of good, and we'll get through it, and massage will happen one day. It might not be today, it might not be tomorrow, but your aches and pains will get relieved by some massage soon. And just be grateful for everything that you do have. And I guess that's really all you can do, right? Everybody said it a million times. I know everybody's had, or each person has a different degree of what they're dealing with, but all in all, we really are all in this together, because we are all dealing with it in one form or another. So I again thank everybody who does watch these videos, and I will be back next week for we'll probably do the shoulders and the arm and hands. So again, I'm always here if there are any questions. I hope you have a great week. And again, if you do anything for Memorial Day, if anything should be opened, or if you go onto the beach, since they will be opened, please just be safe, use your common sense, and have a good one. I'll see you soon. Bye-bye.